Look, doctors know how to have difficult conversations with their patients. And sure, we make mistakes from time to time, but not so many that we need to challenge the status quo for communication. I get comments like this from time to time, and while I know doctors take patient communication very seriously, I have to wonder two things. Number one, what are we calling a communication mistake in the first place? We often think of a mistake in communication as something the doctor must have said wrong in a conversation. But what if your doctor never has the conversation with you in the first place? You know, like a conversation about what matters most to you? That thing we almost universally agree ought to be driving healthcare decisions? Because if your doctor never has that conversation with you, then you never get the chance to shape your healthcare in a way that's most consistent with your wishes. And that sure feels like a mistake to not offer you that chance, right? So the follow-up second question here is, how many of these missed opportunities are acceptable before we do challenge the status quo for communication? Let's talk numbers. The John A. Hartford Foundation asked folks in the U.S. over the age of 50 if a healthcare professional had talked to them about what matters most in the past 2 years. And over half these folks said no one had talked to them about that. California Healthcare Foundation asked folks over the age of 65 if they talked to their doc about end-of-life care. And while over 60% of these folks wanted to have that conversation, only 13% had. So you tell me, do you think we need to challenge the status quo for communication yet?